A new ACC18 form has been created to cater for the new requirements for medical certificates. Medtech Evolution provides the ability to submit directly to ACC now. However, the existing ARC18 form has been retained and can be utilised to submit historical ARC18 forms manually. To access this form, under the Patient ribbon menu, under Accidents, you will see a new icon that says ACC18. First, we will start on the Injury Details tab. The Injury Details tab allows you to select the ACC45 number. This brings up a list of the patient's accidents. Select the one you are wanting to complete the form about. Once that's been selected, the injury section will be populated with the diagnosis code. If you require additional diagnosis codes, you will need to use the Add button at the bottom left-hand side here. The ACC18 form, as well as the ACC45, allows you to add 10 diagnosis codes. Existing diagnosis codes can be changed by entering a different diagnosis in this field here. Please ensure that the most relevant diagnosis is the primary diagnosis by selecting that checkbox. The ACC18 number will be generated by ACC. It will only be displayed once this form has been successfully accepted. On the Ability to Work tab, you can enter unfit for work, initial and subsequent restrictions to these time periods. You can also allow the entry of the date of when the patient can return to normal work. The following rules apply to the Ability to Work tab. You can only enter subsequent restrictions after initial restrictions time periods have been entered. If fully unfit for work dates have been entered, you must provide details in the comments field. The ACC18 form allows entry of up to 3 time periods for time off work or restricted work, i.e. you can enter a combination of 1 period of fully unfit and 2 periods of fit for some work on the same medical certificate. The time off work or restricted work time periods can only occur in any order but must have no overlaps or gaps, not start before the accident date, and must end on the day before the date the patient returns to work. If there is an issue with the dates you've selected, a warning message will be displayed with full details of what the error is. Now we'll move to the Assistance Required tab. This tab allows you to enter the assistance that is required for the patient to return to work. If yes is selected, then you must select either of these 2 options. Support needed to stay at work, return to work, or clinical review of patient's fitness for work is needed. If you do not select an option, a warning message will be displayed. The rest of this tab is optional. Moving on to the Provider Patient Declaration. The provider must select the checkbox after discussing with the patient, and the patient authorises the submission of this form to ACC. The date of examination will be populated with the current date. As well as the details specified in the ACC18 form, certain patient demographical data and provider details are also submitted along with the ACC18 form, some mandatory and some optional. For full details of what is required, please read the full release notes. If any mandatory data is missing from the ACC18 form, patient's register, staff or location setup, a single warning prompt will be displayed with full details of what is missing. Once an ACC18 form has been submitted and accepted, it will be uneditable. If rejected or parked, it can be edited. Any changes to the diagnosis after the form has been submitted and accepted must be submitted using a new ACC18 form or the Change of Diagnosis form, which is found under the Accidents submenu here. The form is submitted instantly when clicking the OK button. If the form is rejected due to issues or errors, these errors will be displayed to the provider as well as in the claim status screen. This is also under the Accidents submenu here.